a common question I get is, what can I do in the summertime for my skin? Because I want to tan, but I don't want to let my skin go too much. So what can we do? Well, there's certain lasers and treatments you can do during the summer, has no effect on it. And then certain ones we probably should wait till we're not so much sun exposure. So let's go through those. Now I'm talking from Michigan, North and South Carolina, where we do have seasons. Other states like Florida and California and Arizona, they really maybe have different answers because it's sunny all year round. So what can we do for our skin in the summertime to slow down the effects of age and maybe look better? One is good skincare, and we'll have a different video on good skincare. One is good sunblock. We have a different video on that. So that goes without saying we should do that. What about other things you can do? Botox, fillers, you want to do the lip club. That's something you can certainly do during the summertime, all summer long. No risks at all with the sun exposure. What about laser and energy-based treatments? Well, there are some issues. So some lasers are targeting color, and other lasers are targeting water or some other tissue that's not affected by the sun. So let's go over those briefly. When I say lasers, I might even encompass different energy-based devices that really aren't technically lasers. Sometimes they're called that. So common procedure is intense pulse light, also known as the photofacial. That is a summer, not a great idea. So if you're in the summer and you're not getting much sun exposure, you can do IPL, but if you're wanting to go out in the sun and you have a tan, put off the IPL until the fall. I love doing IPL for prevention and restoration, but during the summertime, we're kind of backing off on that a little bit. What about laser hair removal? Actually, you can do it during the summertime. So there's laser that's safe to do on tan skin. Maybe not go out, sun tanning, like let's say a week right beforehand deliberately, but casual sun exposure is no problems at all. If you did get a recent suntan, we actually use a little bit different energy and a little bit less aggressive treatment. You can still do it. So that's okay in the sun. Fraxel laser and Clear and Brilliant, those are two of our workhorses. Sun has no effect on it. This has a target of water. All therapy. Sun has no effect on it. The target is a tissue. And radiofrequency microneedling, sun has no effect on it. So you can generally do most of those procedures. IPL is the one that I'm not going to do. Something called pulsed laser and KTP laser. Those are too sun sensitive. So your provider will know what lasers can and cannot be done in the summertime. Summertime, we're getting a lot of damage to our skin, so maybe it's more important than ever that we're doing things to restore our skin. Certainly, topical skincare is number one. That goes before anything. But then other things such as Fraxel, Clear and Brilliant, doing radiofrequency microneedling, doing all therapy. We even do something called lip laser and smooth eye. These can be done regardless of sun exposure. So some stuff can be done, and some stuff we should probably hold off until the wintertime. And I have a lot of people tell me that they want to continue to get a lot of tanning and sun exposure, and they don't want to age your skin. Well, you really can't have both. So if you do a lot of sun exposure, you're going to age your skin faster. However, you can really mitigate that by taking good care of your skin, and it won't give you less of a tan. So if you're doing good skincare, you're still going to tan, but topicals actually protect your elastin and collagen, helps restore tissues. We do the lasers, it helps turn over abnormal cells or cells that are dead and dying, and even lift off pre-cancer. So if you're going to get sun exposure, we want to look good with a tan, then we should be taking care of our skin and still have a tan. We're talking about skincare during the summer, which is the same as skincare during the winter, just a little bit different timing. So there's a lot of skincare products you can use. I'm not telling you which ones to use exactly, but I'm telling you which ones you should use all the time, and you use stuff on top of that. So number one is using some type of a good quality medical grade skincare that's a vitamin C. We like this Radiant C. It's got 7 different forms of vitamin C, different isomers of vitamin C, so it doesn't oxidize very fast. It helps the vitamin C get into your tissue, and it protects against sun damage. Doesn't keep you from getting a suntan at all, but it does reduce your likelihood of having damage to collagen, which is the building block to your tissue, and elastin, which causes elasticity or firmness to your tissue. So vitamin C, use it in the morning. It has a half-life, it lasts about 36 hours. So you put it on every morning, you have good protection, not against the sun from sun tanning, but against sun damage. So that's number one. Number two is a retinol. Retinol, there's different types. We use a tretinool. There's multiple different forms of retinol. This is a very effective one. It's an alcohol form of retinol, and it's very tolerable. It's something that's a little strong when you first use it, so you might only use it 3 to 5 times a week until you get up to every day, and some people never need to use it every day. Get a little peely from it, more than you need, use it less often. The tretinool is something that does give you sun sensitivity, so you put it on at night. If you're going out on the boat on the weekend, I would just skip it that weekend and use it during the week when you're getting routine sun exposure, okay? So tretinool normalizes turnover your tissues, helps firmness to your skin, helps with fine lines and wrinkles and discoloration. So vitamin C and tretinool, these are both things that will help brighten your skin, but still allows you to get the same exact sun tan, just brighter, fresher, firmer skin. Glycolic moisturizer or glycolic wash. This actually increases the density of water in your tissues, thickens it up, and gives you actually some protection once again, and helps normalize your skin. If you have oily skin, it becomes less oily. If you have dry skin, it becomes less dry. And for condition specific, I really like this eye repair serum. There's different types of eye creams. They generally have a very mild vitamin C and very mild retinol in them. Retinol is actually a vitamin A, and different antioxidants such as vitamin E and green tea. And then some type of mineral sunscreen. We have both the spray and the cream. I like the spray because I feel that the cream to me feels kind of gross. I don't like creams on me, and I feel like they feel very cold, but they both work the same. And a mineral sunscreen is better than the chemical sunscreens. They don't absorb into your tissues. It just stays right in your skin. It reflects the sun instead of absorbing it. So theoretically, it'd be better for things like melasma. And the minerals are zinc and titanium. So those are the big three would be vitamin C, some form of retinol, medical grade retinol, and a glycolic. And on top of that, a sunblock. The retinol can be used a few times a week. Avoid it when you're gonna be deliberately in the sun, for tanning. The vitamin C, put it on before you go out in the suntan. And eye repair if you're having some issues with the skin underneath your eyes. So thank you very much.